When you start. So you're reading from here and then it shuts.
February is Heart Health Month, and we want to get a jump start on that. So who's here but Dr. C?
That's right. Dr. C's here. We're talking about heart health, heart disease, and women. We love all the women in our lives. So how is heart disease different in women?
So heart disease in women presents sometimes in different ways. In most women, when you talk about a heart disease or a heart attack, they may actually comment on having symptoms present weeks, if not a month, before the actual heart attack. These symptoms may include more subtle signs, such as shortness of breath from just standing still. All of a sudden, you feel like you run a marathon and you can't catch your breath. Or perhaps you're having numbness along the jaw or along both arms. Those can be more subtle signs that you could be having a heart attack. And in many of these women, there are no signs until you have the big attack.
Yikes, it's always so scary, but there are some things we can pay attention to, and there are people who are at risk that may not think they are. So
Yes.
a lot of people assume someone who's a little overweight like me might be more at risk than the fit person standing next to me, but that's not necessarily the case.
Yeah, so heart disease does not discriminate based on age, weight, or anything like that. In some cases, you have a family history of heart disease, genetic predisposition that leads to a higher risk, but you could also have a risk associated if you smoke. The combination of smoking and use of oral contraceptive can increase your risk 20% of heart disease. Women that are in menopause comes along with it, increase perhaps cholesterol levels, hypertension and weight gain, which also increase the risk, and also syndromes like PCOS or polycystic ovarian syndrome also increase your risk of having heart disease. Pregnancy is the other one. It can also come with it if you have low birth weight, premature birth, or pregnancy-induced high blood pressure. That can induce the risk of heart disease such as cardiomyopathy in even pregnant women.
You said it may run in your family, so it's important to ask your mother, your grandmother, your family members if they've ever had this in the past.
Family history is very important, not just with heart disease, but all diseases, but particularly if we're going to find these things and find them early, pay attention to the signs, we want to get a jump start on it.
It's always frustrating I'm adopted, so we never have that information. It's frustrating. So for those people who are lacking that knowledge, I mean, they just need to play it safe and pay attention to all these other symptoms out there.
And speak with your doctor. Really do due diligence on making sure you're getting your regular heart exams, whether it's your EKG, your echo, your stress exams, those types of things. You want to be a little bit more hyper-vigilant, especially if you don't have the family history. Assume that it's in the family and perhaps use that as a guide.
Got it.
That's a good idea. Preventive medicine, other things that we can do to keep heart disease away.
So some are modifiable, some are not. Family history, age, we can't change that.
Right.
But there are a lot of things that we can affect. Smoking, #1 cause. The nicotine, the carbon monoxide, cut the cigarettes because that can actually decrease your risk as well. Making sure that you're staying active, exercise, moving, eating a healthy diet, all the things that we know that we should be doing can actually help us, have lower risk of heart disease.
When it comes to the mistakes people are making with heart disease, does it frustrate you when you keep seeing people that are really, they're increasing the risk factors and ignoring the advice?
And it's not paying attention to the subtle signs that really make you want to just reach out and make sure everyone knows what those signs are. If you are having that chest pain, or if you're having numbness along the jaw, chest tightness, any symptom that's new, that's extreme, talk with your doctor, because again, if you can jump on these signs earlier, we can perhaps save you from having a catastrophic or a big event.
Do you recommend the watches, that track, the EKG kind of stuff, to have it as another tool in the toolbox?
Yes, and I think there's some offices, doctor offices, that actually incorporate that in the medical record. So talk with your doctor and see if they're using that technology in your overall care.
Okay.
Well, the name on the jacket is Cedric McFadden, but we call him Dr. C, and we appreciate him being here today.
Thank you.
Always. Thanks for trying to keep us healthy. We're working on it.
Glad to be here.
Everybody's a work in progress, and you're watching Carolina's Family at 4. We're coming right back.